Basanti is a 8-month-old Chihuahua who was brought to us with a history of sudden swelling in the right eye, which increased progressively overnight. She had a history of hydrocephalus and seizures. They thought it could be an injury because of that, and then maybe she developed an ulcer which kind of gotten worse. So when we have examined her, we have noticed that her cornea was quite bulgy and there was a little bit of greenish discharge that we were noticing at that time. So it kind of gave us that it could be more likely to be a condition called as corneal hydrops, wherein there is accumulation of water in the layers of the cornea that makes it like a big bubble. So it always has a higher risk of bursting, and that would become a full thickness rupture. So in order to prevent that, we have performed a procedure called as third eyelid flap, wherein we use their own third eyelid, which is at this side, and then we bring it up and we put it like a temporary sutures. So it basically acts like a compression from outside that will help in evening out the surface of the cornea that is protruding like that. So after 10 days, when we have removed the stitches of the third eyelid, we could still see that the cornea is still bullous, the bubble like on the side, and we can see the third eyelid being stuck here. So we are right now going to sedate her so that we'll be able to examine better and understand what exactly is happening, and then come up with the next plan.
That hydrops or that swelling was so big that the third eyelid could not completely cover the entire cornea. It covered only half of it. The covered cornea is now much better, versus the uncovered cornea is now bulging out. So what we are doing right now, it's a quick thing. We are doing a repeat third eyelid flap just to cover her entire cornea.